Well, good morning, ladies and gentlemen, and thank you very much for joining us today. And I'm very pleased to be joined here today from people who you will hear from. First, after me, Deputy Mayor Bailão, who's the chair of the Planning and Housing Committee for the City of Toronto. Elizabeth McIsaac, who's the president of Maytree. Maytree is a wonderful organization that does a lot of groundbreaking and very important work in the city. And Maytree and Elizabeth herself were very fundamental in developing one of the two recently released policy papers focused on housing issued by the City of Toronto called the Housing and People Action Plan. And last but not least, Daniele Zanotti, who's the president and CEO of the United Way of Greater Toronto. And I think anybody who knows me knows that as mayor, but also just as a private citizen, I have nothing but the world of admiration for the work of the United Way. And I've been a long time supporter and helper of that organization, which does such great work. And they, the United Way and Daniele, worked on a second policy paper, the COVID-19 Interim Shelter Recovery Strategy, and all of those were instrumental in getting us to today's important news. We're here today to talk about the City of Toronto's COVID-19 Housing and Homelessness Recovery Response Plan. And it is accompanied by an urgent call to the federal and provincial governments to help us in reaching our goals and creating more housing options quickly for vulnerable people in this city. And it's been neatly summarized in a brochure that I hope will be into the hands, if it isn't already, of every single MP, MPP, and anybody who cares about these matters, because I think the time for moving forward with some of these decisions to produce quick results is now. This proposed plan calls for the creation of 3,000 permanent affordable homes within the next 24 months. And I think that is the kind of goal that sometimes in past we would have said wasn't possible or wasn't practical or wasn't feasible, sometimes because the government approvals take that long. But we think that for the benefit of the homeless and marginalized and vulnerable residents of the City of Toronto, especially in a post-pandemic world, this kind of goal is necessary and it's achievable. The 3,000 permanent affordable homes would be comprised of 1,000 new permanent modular homes. And, fingers crossed, we will show with our modular home pilot projects that we have underway in the City of Toronto now, it's possible to go from concept to somebody moving in during a period from June to November of 2020. Secondly, 1,000 new permanent affordable rental homes created through acquisitions and shovel-ready construction projects. There are buildings that could be purchased that could be converted very quickly into permanent affordable homes. And finally, new portable housing benefits that would assist 1,000 people to secure housing and help them in paying their rent. The plan also calls for funding to assist 2,000 of these residents with the supports that they require to maintain stable housing. These are supports such as mental health services, assistance with daily living activities, and focused senior services, because there are instances in which we can provide an affordable home, but the people who are to be the residents still require some additional supports beyond that. I know how vital supportive housing is, and I have throughout my time as mayor stressed the urgency of the other levels of government assisting us by investing in this type of housing to ensure that people have stability within their own lives. It is not within the contemplated mandate of cities like Toronto, but not confined to Toronto, nor is it within their financial means, given the ways in which they can and are allowed to raise revenue, to pay for this supportive housing alone by themselves, municipal governments. That is as well because these supportive housing units are very much a part of a healthcare and social service, a safety net, as it were, that is principally funded by the other governments. Investing more in housing, including more supportive housing, is the right thing to do now. It is the fiscally responsible thing to do now, and we are saying very clearly that we must do it, we want to do it, we're going to do it, but we cannot do it alone. By investing in this kind of housing, we will provide for people safe, secure, and affordable housing options to reduce homelessness, reduce the associated costs of homelessness for all orders of government, and all of this will help support economic recovery. Shelters are and were always meant to be short-term emergency solutions. But what we need now is longer-term solutions, and this urgent call lays out a roadmap on how we can work together as governments to get some of those solutions, those longer-term solutions, in place very quickly indeed. The average cost to operate a shelter bed in Toronto was over $3,000 per month before COVID-19. The cost has now doubled as a result of the increased space and protective resources required as a result of the pandemic. So, for example, where in circumstances before didn't have some of our vulnerable residents living distanced 2 meters apart, we've now made arrangements such that they are, for health-related reasons. This obviously carries with it a substantial amount of cost and explains why we've had to move thousands of people during the course of the pandemic. Accommodating one person in permanent, affordable, supportive housing, on the other hand, such as, say, a studio apartment, can cost approximately $2,000 per month. So simply put, it is now, in the present circumstances, with health-related considerations taken into account, more cost-effective to build or acquire supportive housing than it is to build and operate more shelters. Moving 3,000 people out of shelters and into permanent housing with supports could provide a cost savings of up to $15 million per month. That's $180 million per year, for as long as we need to have the COVID-19 physical distancing standards in place. And of course, based on everything we know today, that will be probably for some time to come. And since all of the governments share in the cost of operating and funding these different kinds of temporary emergency shelters that are increasingly in use, all governments would be the beneficiaries of that kind of saving. As the Toronto Star editorial board said, it's time we build housing, not shelters, for the homeless. This plan will also help us to create much-needed employment opportunities, getting people back to work at this critical time, because we know that infrastructure investments create employment opportunities. For every $1 million invested in housing, approximately 10 direct, indirect, and induced jobs are created. And more importantly, these investments will support our Housing TO 2020 to 2030 10-year action plan that is aimed at helping more than 340,000 households in Toronto over the next 10 years. These will all go towards that goal, but it can be done in much more rapid fashion than might otherwise be the case. So what you have here is a clear moral case to act. We've always had that, together with a solid business case for doing it in this way, both because it saves lives and makes quality of life better, and because it saves governments money and creates jobs and economic activity all at the same time. We know that we cannot meet these goals on our own. We absolutely cannot as a city government, and I think that's true of every city across the country, because these are issues shared in common and requests that are shared in common in terms of support for these kinds of initiatives. We know that we need help from the other governments. Partnerships with the other governments have been proven to work in housing and a number of other areas, including our management of the pandemic. I want to take this opportunity to acknowledge that during the pandemic, we've received substantial support from the Government of Canada and from the Government of Ontario to assist us in getting through the pandemic and addressing some of the financial issues that arose because of, for example, reduced transit ridership. But as we all know, there is more work ahead of us. And now, the way in which we address these issues concerning homelessness and housing are a clear priority and have been heightened, in fact, by the experience of the pandemic. There is a link between housing and public health. We've heard that over and over again from our medical officer of health when it comes to the circumstances in which COVID-19 has spread. And so we need to build solutions that respond not just to the emergency situation, but also focus on the recovery and the prevention of illness and other things that have to do with the social determinants of health going forward. When all governments work together, we can accomplish these things, and we can do even more. Toronto is not alone in this housing push. I've been working with the mayors across the country, especially from the bigger cities, and with the Federation of Canadian Municipalities, to make our case to the federal government, in particular, since they are presently constructing a throne speech and a COVID action plan for Canadians. I believe we must seize this opportunity. We must together do this, federal, provincial, and local governments, to do things differently and better while getting more people housed more quickly in permanent and appropriate housing. At the same time, we will reduce the costs of delivering emergency shelter services, improve health outcomes, and stimulate economic recovery. It is a win-win-win. And through the recovery, we have to build on our joint commitment that no one will be left behind. This will ensure that we build back and build back better. I've been in frequent contact with key federal ministers and Toronto MPs about these initiatives, which we're discussing here today publicly, and it could provide, if they're adopted, for very fast results on housing for some of our most vulnerable residents, and do so quickly in a cost-effective manner. I will now ask a true champion for housing and affordable housing and supportive housing in our city, the chair of our Planning and Housing Committee, and someone integral to pushing through the various initiatives under our Housing TO Action Plan, Councillor and Deputy Mayor Anna Bailão, to say a few words.
Thank you, Mayor, and thank you for all your work. And thank you, Danielle and Elizabeth, and through you to all the participants in these two task force, many of them that are in the front lines dealing with homelessness issues and with housing issues. Thank you for your advice, your guidance, and all you do day in and day out. The COVID-19 crisis is having a significant impact on the health and socioeconomic well-being of our residents and of our city. And it has very clearly exposed gaps and vulnerabilities in the housing and homelessness systems, ones that existed even before COVID-19. It is no surprise that from a housing perspective, residents hardest hit by the pandemic are those who are economically and socially vulnerable and marginalized. The pandemic has shone a light on this and made it abundantly clear that good housing policy and good health policy cannot exist without each other. The lack of access to affordable, suitable, and adequate housing during the COVID-19 pandemic has been as much as an individual health risk as it is a larger public health risk. The reality is that the crisis has highlighted the fundamental interdependencies of our housing, health, social, and economic systems. And now, our aim to emerge stronger from COVID-19 must include a clear housing focus based on equity and resilience. In late March 2020, in response to the COVID-19 crisis and at the request of our mayor, I established a housing action team comprised of representatives from various sectors brought together to help identify solutions and plan for longer-term recovery. We have worked hard and developed a report, the Housing and People Action Plan, that includes a number of policy actions and considerations aimed at providing stability for cities and people, stimulating economic recovery, and building resilience. Simply put, we need more housing, and we need it now. The report outlines a number of actions to help make this happen, but our first priority, and as also the United Way report with SSHA also outlined, and why we are here today, is our very important and very urgent appeal to the federal and provincial governments to work with us to create 3,000 permanent, affordable homes within the next 24 months, and to ensure that we can provide the additional support that will help these residents successfully maintain this housing. We need to do this. It is the right thing to do. It is also the fiscally and socially responsible thing to do. Mayor Tory has already outlined a number of the economic fundamentals. Let me add to that, noting that it is estimated that for every dollar invested in supportive housing, that is $4 to $5 created in social and economic value. The current pandemic highlights both the urgency and the opportunity to all governments to make investments that will quickly provide innovative housing options to help manage the challenges associated with COVID, while also creating solutions that will support people for decades to come. In the wake of this pandemic, it is vital that we now jumpstart and accelerate our efforts across all governments to create new affordable homes for everyone, including residents experiencing homelessness, newcomers, and essential workers. To me, this is very clear. Do we want to look back and have just invoices for hotels, or do we want to look back and see some keys for long-term supportive housing? It seems so clear. Every challenge is an opportunity. It is upon all orders of government to work together and to seize this opportunity, to build back together, and I know we can do it. It is now my pleasure to turn it over to Elizabeth McIsaac, President of Maytree.
Thank you, Deputy Mayor Bailão, and thank you, Mayor Tory, for leading this urgent call to create 3,000 permanent, affordable homes in the next 24 months. As the Deputy Mayor has pointed out, the pandemic has highlighted how vulnerable our housing and homelessness systems are. In fact, what COVID-19 has shown is that the right to housing isn't just a nice idea. For those residents hardest hit by the pandemic, it's a matter of life and death. The right to housing was recognized by the federal government in legislation in 2019, and it's an important part of the City of Toronto's Housing TO 2020 to 2030 action plan. And if you ask me, and people have done so frequently, what the right to housing actually means, what does it look like, I would say it begins to look a lot like this. It's about all three orders of government doing the right thing as fast as possible and reaching as deeply as possible. It's about recognizing the need to create a recovery plan that includes everyone. And it's about putting the dignity and safety of people at the center. Unless everyone has access to safe, secure, and affordable housing, we cannot have a strong, vibrant, and inclusive city. Instead, we will continue to leave a large number of Toronto's residents vulnerable to the impacts of COVID-19. If you don't have access to safe, secure, and affordable housing, how can you stay at home? To stay safe and to fight the spread of the virus. It's just not possible. And this, in turn, puts the health of everyone at risk. Ensuring that we realize the right to housing is not the job of just one order of government or one stakeholder group. The initial emergency measures taken have shown how quickly, how effectively we can all work together. And if we are truly in this together, we have to go beyond emergency measures and start focusing on measures that address the systemic gaps and vulnerabilities in the long term. By answering today's urgent proposal and appeal, the federal and provincial governments would become an important partner in starting to close the existing gaps and realizing the right to housing for everyone. Thank you, and I will now turn it over to Daniele Zanotti, President and CEO of the United Way of Greater Toronto.
Thank you, Elizabeth. Thank you, Deputy Mayor Bailão and Mayor Tory. On the front line, in neighborhoods across Toronto, United Way agencies like Dixon Hall, providing emergency and housing support, including the Out of the Cold program. Costi, operating emergency shelters for newcomers and refugee families. Name Res, that runs emergency shelter, transitional housing, and long-term independent housing for Toronto-based Indigenous men. And the 519, helping homeless and marginally housed people from the LGBTQ2S community. This community sector plays a critical role in the service and solution response for people experiencing homelessness. As the largest non-governmental funder of social services, United Way partners with our network of agencies and local government to meet urgent needs, contribute to longer-term solutions for homelessness, and give people the wraparound supports they need to stay housed. And we have been hearing consistently from our agencies across the GTA, without safe, secure housing, people far too often remain trapped in a cycle of poverty for far too long. This is why we are proud to join the city's Shelter, Support, and Housing Administration Division and co-chair a task force of key leaders, both in the homeless serving sector and across a range of sectors, to develop an interim shelter recovery strategy. The task force generated the advice and recommendations in this report from the collective expertise of contributors, lessons learned from the first phase of the pandemic, and established knowledge about solutions to prevent and end homelessness. The report's first recommendation is to invest in housing and supports to decrease the volume and duration of need for emergency shelter. Because emergency shelters are designed to serve much like the emergency departments in a hospital. They are an essential last resort in cases of immediate emergency, spaces for short-term safety and recovery. but 22% of the people who used Toronto's shelter system in 2019 are chronically homeless and stay in that shelter system for 6 months or more. Providing permanent, supportive housing for the chronically homeless is critical, both to meeting their needs and ensuring the system has the capacity to perform its intended function of serving as a pathway to stable housing for those in emergencies. By coming together across sectors, health, community services, shelter and housing providers, different levels of government and funders, and bringing together a range of voices, including the Black and Indigenous communities, we can take an integrated approach to provide real solutions to end homelessness. Urgent, unignorable needs, an unprecedented time, and a moment where together, in a united way, we can design a path forward for a GTA where people no longer struggle to find stable and secure housing. Now I'd like to pass it back to the Mayor and open the floor for questions.
Thank you for joining us today. We will now open the floor to questions. As a reminder, it's one question, one follow-up. We also have Abby Bond, Toronto's Executive Director of the Housing Secretariat, and Marianne Bedard, General Manager of Shelter Support and Housing Administration on the line. First up, we have Travis from Global. Go ahead, Travis.
Hi there, Mayor Tory. Thank you for taking my questions today. Good to talk to you. Listen, I want to go back to something that Premier Ford said the other day during one of his news conferences. He said it is up to local public health officials and mayors when it comes to tightening restrictions. That under the Health Act, under Section 22, they can put restrictions on group sizes, public gathering sizes, and also up to shut down nightclubs and bars if they choose to do so. So why doesn't Toronto shut down nightclubs and bars and restrict group gatherings to lower numbers when we are seeing the numbers go up in Toronto?
Well, the first thing that we've done that I think people would expect us to do is to try and establish, given the increase in the cases that we're seeing, what in fact is at the root cause of that increase in cases. And what the medical officer of health said yesterday, and I agree with her because I rely very much on her for advice on these things, is that it isn't so much the setting in which things take place as it is the kind of gathering and the way people behave at those gatherings and the size of the gatherings. And so I think that, as the Premier has said, and he and I agree on this, it is social gatherings we're going to have to go after within the context of public education. As he has said, and I have said, all of the things that have to do with those kinds of social gatherings are under consideration, depending on how things go with regard to the cases. And with regard to the question of legal jurisdiction, he and I guess, have politely agreed to disagree for the moment as to how far the municipal authority to deal with these things goes. He believes it goes further than our lawyers tell me it goes. And we think the most effective way, even if it's done regionally, to address these kinds of concerns, as has been the case through the pandemic, is through provincial order. But for the moment, all of that talk is, premature, and that we're working hard together and very cooperatively to try and figure out, what are the best things and the most effective things to do, as opposed to reaching any conclusion about any particular kind of establishment.
So I guess you're saying that your hands are legally tied here, and then it's up to the province. I do want to follow up on another question for a colleague of mine, and it comes to back to school. As you well know, thousands of kids are going back to school in Toronto today. You have grandchildren. I'm just wondering if you can tell me a little bit about your level of anxiety right now with kids going back to school, and whether or not your grandkids are opting for online or if they are going to in-class learning.
My grandchildren are all at school. That was a decision their parents made, but that's a decision in which I concur, because I think that the plans that have been put in place by the school boards and by the government certainly, I think, should give people confidence that while you can't possibly cover off every eventuality, that the government's working together with substantial federal financial assistance and with help in the case of Toronto from us with public health nurses and other things, I think, make for a good opportunity for kids to be back at school, which I think is a positive, and be there in a very healthy manner, which is a priority. And so we'll have to see how this goes. But obviously, I, as a grandfather, and I'm sure other parents and grandparents across the province are worried about this. They're concerned about this, and properly so. And I guess we will know more, and we will learn more, and we will change more based on the experience that we have in these opening few days. Hopefully, changes that are not necessitated by any major health, negative health outcomes.
Next up, we have Haley Cooper from News Talk 1010. Go ahead, Haley.
Thank you. Hi, Mayor Tory. We wanted to talk about stunt driving. It's becoming a big problem in Toronto, especially with what we saw this past weekend. It's quite honestly a miracle someone wasn't killed or seriously injured. And police are reporting that stunt driving charges are up 357% between March and June compared to last year. So I just wondered if you've had any conversations with the chief of police and what the city is planning on doing about this to put an end to it.
It's an epidemic. It is an epidemic that has been caused by people who are thoughtless, who disregard the safety of themselves and others, and who have also shown a huge disrespect for police when police try to intervene. I have spoken with the chief this morning, and I can just say to you that without giving away how they're going to go about things, which he directs, not me, they're on this, and I think that we need to bring down the full weight of the law on these people. This is not the Fast and the Furious we're operating here. This is a city full of people, full of other drivers, pedestrians, cyclists, who need to be kept safe, and this kind of wanton disregard for that sort of thing is just not acceptable. So I think you'll find that increased efforts will be made to try and bring these people to justice and put a stop to this.
Thank you. And I know we're not going to show the hand of Toronto Police, but does that mean increased enforcement, more patrols in these hotspots?
I think you're going to see a cooperative effort on the part of police services, because oftentimes this activity occurs at or across some of the borders. I think you're going to see it happen in all parts of the city, because the stunt driving and drag racing and noisy driving is not limited to the outer suburbs. It's also happening downtown. And so I think you will see a significantly increased effort on the part of the police to come to grips with people who are just absolutely behaving in a way that it disregards safety, it disregards the rules of the road. It's just bad all the way around.
Okay, next up we have Jennifer Pagliaro from The Star. Go ahead, Jennifer.
Hey there. I wanted to ask about the funding plan for this new action plan. I see in the attachment that it's largely reliant on other levels of government, apart from, I see some city land and operating funds for the modular housing. So I'm just wondering what the status is of that funding. You're on a tight timeline here with 24 months, but I know that that money doesn't currently exist. So when you're telling people this housing will be created in 24 months, how achievable is that really?
I think it's very achievable, and I think when you put forward the business case that accompanies the moral reasons for doing this, it becomes one that the other government should be embracing rapidly. And while it involves hundreds of millions of dollars, let's not forget that we have demonstrated, and we do demonstrate in the materials that we provided for the other governments, that in fact this will result in a savings of very substantial sums of money, millions and millions of dollars not spent, and in effect gone through, as Deputy Mayor Bailão said, the paying of invoices. What you have, if you just continue with the present system, is the payment of invoices, and yes, we provide a degree of shelter for people who need it very much, but you don't have an asset. And if we, for example, proceed to acquire some buildings at a time when we can do that, and very quickly turn that into supportive or affordable housing for some of our vulnerable residents, we own an asset at the end of that. So the federal government and provincial governments are participating in helping to finance the acquisition of an asset. The same is true with the housing benefits. If they move forward now to simply do what we're asking them, which is to accelerate those housing benefits. They're provided for in future years. We're saying the time to act is now, because we have a particularly urgent problem now with thousands of people who have been put into greater jeopardy by the pandemic, and we're just accelerating an investment that, again, will save money because the housing benefit will cost us less and put people into permanent housing than would be the case if we left them in hotels. So it's a lot of money. It is to be shared between and among the governments. It is spread over the period of time that we're going to provide the housing, and some of it goes on beyond that because of the affordability, say, on the housing benefits having to last. But it is a good investment in many different respects.
And so can we just be clear on how much money do you need from each level of government?
Well, do you want to answer that, Anna? I mean, it's here in the, I can give you that if you want to.
I mean, we have an overall cost. Usually the negotiations happen between the provincial and federal government. We have a total cost. If they go 50-50, 40-60 on what we're asking, as long as we get the funds necessary, and it is a big ask. So for the 1,000 modular homes, it's a $200 million ask. Obviously, 250 of those have already been committed. The $200 million come with an operating cost of $24 million in supportive services. And then there's an ask for the acquisition fund of almost $500 million, which is very much in line with, for example, what the Federation of Canadian Municipalities also put forward. They were asking for approximately an acquisition fund of $3.5 billion across the country. So we've been working closely with them on these numbers as well. And this is not an ask just from Toronto. Cities across the country are asking for solutions like this. The reality is, as you've seen, Jennifer, the numbers are staggering. The amount of money that we're spending a year, as the mayor said, it's over $180 million that we're spending on the new shelter conditions. This money could be invested in permanent housing, modular, or through the acquisition fund and the acceleration of the housing benefit. So it's the smart investment, and at the end of the day, we have long-lasting legacy and better housing for Torontonians, especially the most vulnerable Torontonians.
May I just say, Jennifer, one more thing, which is that we have many meetings of the big city mayors and discuss many different issues, especially during the course of the pandemic, and I've rarely seen a more unanimously held view on the part of the big city mayors from across the country on two things. First, that affordable housing is a huge priority for all of us as mayors and in these big cities coming out of the pandemic for the reasons that we've discussed this morning. And secondly, the support for an acquisition fund, which was the main item supported by the big city mayors, which is a fund pursuant to which the federal and provincial governments, but we asked principally of the federal government, would supply us with the money to buy buildings at a time when they're actually available for conversion into permanent and supportable housing, is also very strong across the country. So this is something where they would have a positive impact and it would be received well in every major city in the country, all of which share an issue similar to, although smaller in scale than Toronto's issue.
Next up, we have Julianne from Radio Canada. Go ahead.
Thank you. Bonjour, Monsieur le maire. J'aimerais vous entendre en français sur l'augmentation des cas de COVID à Toronto. Est-ce que ça vous inquiète et avez-vous l'intention de durcir les mesures comme de fermer les bars ou les structures de jeu, par exemple, dans les parcs?
Maintenant, c'est un grand problème pour nous, d'accord, mais la solution maintenant est d'identifier les causes de ce problème, et maintenant, ce n'est pas possible pour nous de déterminer que les causes est les restaurants ou les bars, mais maintenant nous savons que le comportement des individuels, c'est un défi pour nous, pour qu'est-ce que c'est le mot pour masque, les masques et la distance entre les citoyens et les autres, ce sont maintenant les solutions principales que nous allons recommander aux citoyens. Pas des autres mesures maintenant. Quand nous qu'est-ce que c'est le mot, investigate les causes et assurer que les mesures contre les autres établissements, ce sont les mesures correctes.
Mais vous parlez beaucoup d'éducation publique pour encourager les gens à respecter les règles et tout ça. Est-ce qu'il y a des plans de sévir, de donner des contraventions aux gens pour s'assurer que le message passe?
Les mesures de la santé publique, ce sont simples. Ce sont les mesures comme laver les mains, comme porter les masques et comme maintenir la distance entre les individuels. Et ce sont les mesures que nous avons discutées par beaucoup de mois maintenant. Mais c'est les mesures les plus effectives as told to us by the medical officer of health.
Okay, next up, we have Mark McAllister from City News. Go ahead, Mark.
Good morning, Mr. Mayor. If you could start, and then perhaps if you've got a colleague or a staff member that would like to answer as well, we can turn to them. You've struck a deal with some groups in the TDSB in and around the Roehampton Hotel about extra police presence, security measures, safety measures in that area. We've now learned that the same concerns have been brought up in and around Bond Street and the St. Michael's Choir School and parents there. Just wondering what you can tell us about the measures that are taking place outside Bond Street, and how do you address the concerns that are being brought up by parents there?
Well, I will just say that the measures undertaken around the Roehampton shelter were the result of extensive consultation that took place between and among school boards, principals, parent councils, the police, and other residents, and the shelter officials, and they developed what I think is a very comprehensive plan that was then distributed and reviewed in draft by all of those people, and the result, I think, was something that is going to be very effective at our principal objective, which is to keep people safe, kids and others, while at the same time recognizing the obligation we have to look after vulnerable people. I'm not familiar with whether the same exercise has been undertaken with regard to the Bond Hotel and the proximity of the St. Michael's Choir School, but I can just tell you as mayor that just as I was one of those, together with the local councillor and the trustees who initiated the discussions to develop a similar game plan for Roehampton, that if one is needed and one is appropriate for the Bond Hotel, then we are happy to be the convener of those discussions, or one of the conveners, recognizing the school board and the school has some responsibility there as well.
Okay, and we will see if Marianne has anything to add to that. Marianne, go ahead.
Good morning, and thank you for the question. Yes, we have developed an enhanced care model for some of our hotel programs, especially some of the larger ones. This model includes increased security, coordination with local police divisions, on-site delivery of healthcare services, additional housing caseworkers to help people move quickly and rapidly into housing, as well as community safety teams that are out in the neighborhood, engaging with people that they find out there, and also being available to pick up any garbage or deal with any situations that they find. We have engaged a third-party facilitator to help us with our community engagement processes. And together with Councillor Wong Tam, we held our first engagement meeting last week. We are also having discussions with St. Michael's Choir School, and we'll be working with them to develop a very similar school safety plan, which has many of the components that they have up at the Roehampton.
Thank you, Marianne. Okay,
Thank you.
Mark, go ahead.
Can I just add?
Oh, yeah, go ahead.
Sorry. I just think these situations clearly highlight the need for our cooperation with the other government order of governments, in particularly around supportive housing. These are situations where we need our mental health partners. These are healthcare situations, and we cannot do this without also the provincial government coming to the table and assist us and look at this situation as a healthcare issue as well. And this call that we're doing here today, yes, there's the component that is the bricks and mortars, but the supportive side of it and the support services that we're asking cannot be ignored. And this is a perfect example how these situations need to be addressed in a holistic way and with the three orders of government at the table. Only then will we get success.
Thank you, Deputy Mayor. Go ahead, Mark.
As a second question, Mr. Mayor, if you could speak to this. Yesterday, Dr. Davila had raised a few examples of cases where large social gatherings had been taking place. One we have found out is a wedding that had taken place over the course of the weekend in the city that involved more than 300 guests, and there were positive cases of COVID-19. While I understand the number of people at a gathering is something that the province has put out, is there something that the city can do, especially when it involves an establishment in the city, to keep this sort of thing from happening, or to come in afterwards and make something happen?
I will just tell you, in the wake of a request that I had made of Dr. Davila to make some of that presentation yesterday with respect to some of the causes or how these cases came to be, we had a meeting after yesterday's media availability, at which time we asked that her offices at Toronto Public Health, plus the legal department of the city and others, look at all of the different challenges that we face with regard to social gatherings and things like that. Look at how effective anything that we or the province might do, or both, to address those might be in containing the spread of the virus, and we're expecting to hear back in that regard at some point in the next couple of days, because I think it is important, and she made this point yesterday and I would underline it, that we focus on what is going to work best. Even I have changed my thinking from listening to her about the fact that it isn't a particular category of establishment that necessarily, represents the key to fighting COVID-19 more effectively and stopping the spread, but rather it is the behavior of the owners in some isolated cases. It is the behavior of people. I think that is the first and foremost consideration that we have to address, is the behavior of people. People, and I hate to say this in a way that sounds, condescending, because I don't mean it this way, but people should have known better than to go to a wedding involving 300 people, because I think we've talked often enough now about what the limits are and how you can't possibly be seated, physically distanced, in a wedding of 300 people, such that then almost by definition represents a threat to public health. And so people, as I said earlier people, if they see a party bus, don't get on it. If they are on a bus that seems to be turning into a party bus, get off. If you're at a wedding and you show up, even if you've been invited and didn't know that it was a 300-person wedding, you're probably best not to attend, as much as that may be unusual from a protocol standpoint, than to subject yourself and subject others to the possibility of illness. And I think a lot of it is going to be about personal behavior, but we've asked for a full assessment of the different things that could be done in an effort to really get at these numbers effectively, as opposed to doing things that may sound good but aren't really going to help with the cause.
Okay, our last question today is Momin Qureshi from 680 News. Go ahead, Momin.
Good morning, Mayor Tory. Just wanted to follow up on what Mark said there. You were talking about yesterday that you can't legislate common sense, and that we know that a lot of the cases, the majority of cases right now, are coming from younger people who are ignoring the rules. So realistically, other than kind of repeating that people need to follow the rules, what can be done to try to curb this spread and this behavior?
Well, and I'm not suggesting these are things that anybody's going to do, but obviously you could alter the limits that are presently in place with respect to indoor and outdoor gatherings. If it's proving to be the case that, that the limits that are in place are either being abused, repeatedly, or are just not adequate to contain the spread of the virus, you can obviously look at what some of the requirements are now and where they apply with regard to face coverings, and that is a controversial issue with some, not with me. I think that the policy we should adopt is the more people can wear masks in more places at more times, the better, because it has been proven to make a contribution. And so I think a lot of it is public education. A lot of that relates to personal behavior, but there are things that we could look at doing. But again, our objective is to look at where it's going to be effective and where the problem really is. And we're finding the more we look that it is less to do with the category of place where people might be at a given point in time, and more to do with how the owners enforce the rules or don't, and how people behave themselves. And so we're going to have to look at ways in which we can try and enhance that and make sure it happens better.
And so just to, not to put you on the spot, because something did happen this morning, that we heard that there are some people lined up outside the William Osler Health Center to get tested that are being turned away potentially because of some sort of technical issues. I just wanted to know, A, if you've heard anything about that, and B, if that kind of thing raises concerns for you in terms of, backlogs and people needing to get tested that won't be able to now.
I'm not aware of that, a particular instance. I was aware of the fact that there has been a lineup, a problem, and that I think that contributes to people deciding they're going to walk away from getting tested for a moment in time, which is not good, because people who feel they should get tested or need to get tested should get tested. I know the Premier is on this. We had suggested yesterday some extension of hours and other things that could be done with mobile testing and so on to enhance the resources we have available to people. And I know they're looking very seriously at all of that, and I'm sure whatever technical issues have come up within the testing system, which is a provincial responsibility, I'm sure they're attending to it to try and get things back on track.
Okay, that's it for today. Thanks, everyone. Have a great day.